Welcome to another segment of Under the Microscope. I'm Jeff Gold, and thanks so much for being with us today. I'm joined by Dr. Boyers, and we're here at the first annual iEXCEL Expo. Thanks so much for giving us a few minutes.
It's a pleasure, Dr. Gold.
So would you tell our audience about what's going on here? I mean, there are lots of people, equipment, technology, and what's the purpose of it, and what are we seeing?
Well, today is our very first iEXCEL Expo Day. We thought we would hold it during Innovation Week that's put on by UNMC each year.
How appropriate.
Yes, we're hoping this will become a tradition. But what we are doing is we're exposing the faculty, staff, and students to all the latest technology that's available in simulation and healthcare. And we have two different groups of people here. We have some of our faculty innovators who are showing their innovations as they enter the 3D and virtual worlds. And we also have our industry collaborators here who very kindly brought this amazing equipment for us to see, test, and trial. And the most important thing is to see how we can apply it to improve teaching, learning, and research at UNMC.
Well, I've had the opportunity of speaking with several of the students who've been through, and as you know, not only have we had our health science students through, but there have been some high school students through and others, and the energy level is just incredible. I mean, I've spoken with a couple of faculty members, and they also feel very, very engaged in this.
I'm very glad to hear you're getting that kind of feedback. Yes, the high school students were enthralled. They literally swarmed the place, and they were very, very quick to understand the technology and especially work with the digital technology. They seem very facile with it.
So, you know, we refer to those students as digital natives, meaning they were born into an era that they never even knew the internet didn't exist, and they are very facile. You know, instructions are, not always essential, and they are very, very gifted at figuring things out. But how do you think this will transform the way we educate the next generation?
Well, first of all, I think it'll excite them about learning. I think they learn very differently because of their experience with smartphones and digital devices. So I think exciting them about learning is very important. It engages them very deeply in learning, and where they can get a little bored sometimes with lectures, they like to interact. It also makes them interact with one another as they work together to help advance and push the limits of the technology. And of course, we're also very much hoping that it will help them improve retention.
Well, that's exciting because as they get more engaged, as they retain more, develop better skills, they then pay that forward in the way we deliver healthcare to our region, to the country. So I guess in many ways this is an exciting day because it's also an aperitif, a sample of what the iEXCEL Center will bring to campus.
Yes, I think what's been most exciting is seeing not only students but the practicing staff from the hospital, from the cath lab, for example. Students, learners at all levels of sophistication as it relates to patient care. Those learning how to take care of patients and those actually giving care to patients. So clearly the ultimate goal is to use this technology to advance patient safety, improve patient safety and quality of care.
Well, thank you so much for giving me a few minutes from your day, and thank you for being with us on this segment of Under the Microscope.